And hospitalizations in Mississippi reaching a record high with 1,340 confirmed COVID-19 patients hospitalized across the state. Joining us now with his insight into the COVID-19 battle in South Mississippi, Singing River Health System CEO Lee Bond. Lee Bond, thank you so much for joining us. And of course, as we continue to look at these disturbing numbers, we have to ask, what is the situation in your hospital at Singing River Health System?
Well, Karen, it's tough. We're managing. It's tough, but our people are tougher. And today we had an unfortunate new record high between all three hospitals in Pascagoula, Ocean Springs, and Gulfport of 82 COVID positive patients. We've got 25 of those are in the ICU, and of those we've got 12 on ventilators. So it's tough. Our emergency rooms are very busy, but they're here to serve and they're managing, and I couldn't be more proud of the people that have been doing this for 9 months, now reaching a new pinnacle. They're as tough as ever, and just couldn't be more proud of them.
My goodness, I know statewide it's the highest number today, and then here in South Mississippi too. So it is definitely an unwanted trend right now. And as we move into the next couple of weeks, how concerned are you? Because of course, part of this is holiday numbers from the beginning, starting with Thanksgiving, and now we're beyond Christmas, going into New Year's. We still have a ways to go before we see all the results of all of the family gatherings.
True, and then, you know, it's probably as much as that, it's also the seasonality of winter. You know, people are in their houses more in wintertime, and so you couple that with the holidays and, you know, just put it all on top of each other, and it just creates a recipe for a situation. And, you know, there's some people that listen to, you know, what we preach, the dowhatiktakes.org, where we've got our little, you know, our recommendations listed. Some folks are going to listen to that, and some just aren't. So to answer your question about my concern, yes, I'm very concerned. I'm concerned that you know, New Year's Eve is about to be here, and people are going to get out, and we can't stop people from you know, having a good time partying. People are ready to be done with 2020. But we ask people, those who will listen, to try to party responsibly and not, you know, spit in each other's faces when they're close talking, and, you know, keep their hands clean and don't share drinks, and, you know, try to physically distance if at all possible. But for those who don't, we're making our worst case scenario plans for if there is a new pinnacle that we reach in about a week or two, that we're prepared to serve our constituency of the Gulf Coast as best as we absolutely possibly can.
Well, let's talk about that potential, because if you're seeing record numbers today and the numbers are continuing to grow, how serious could that become in the hospital? I'm not sure. You said 82, I think, hospitalized with COVID right now. And what about the ICU, ventilators, those kinds of things? Are those at risk right now of not being available in the near future?
Well, you know, there's no risk of ventilators not being, but we got plenty of ventilators. We've got, the problem is when people say that all over, I hear people on national news saying a shortage of beds. There's no shortage of beds. There's no shortage of ventilators, really. There's a shortage of qualified nurses in the world to take care of people. And, you know, a nurse from South Mississippi can go to New York and Alaska and Kentucky and make, you know, a great, phenomenal amount of money. They're so in demand. And so that is probably the most critical resource for all hospitals in our state right now is those frontline nurses. And I'm proud of all of the warriors who have stayed here to help fight for their community. And our outlook is that, you know, it's probably going to get a little worse, and we're not going to whine or be fearful of it. We are just going to stand up and figure out every little thing we can do to face it, whether we have people like a CRNA or a nurse practitioner helping do a job that maybe they didn't do in the past. We've made some contingency plans for that, so that if it does get worse, we're in a position to where we can manage it. We're already seeing from Central Mississippi transfers down here because they are completely saturated. And so that could be a precursor for what could happen in other areas. So we've reached out to our friends in Mobile and Alabama about how they can help us a little bit too. But it is very concerning, Karen, but we're going to face it head on, fearlessly.
All right, I know, like you have been. Thank you so much, Lee Bond, CEO at Singing River, for joining us today.
I need you right now.